2D dental x-rays are the world's most common medical imaging procedure. Pretty much every dentist in the world has a 2D x-ray machine. They're really cheap, they give a low dose, and you can bring them directly to the patient. Now, 3D dental imaging machines do exist today. They're based on CT technology, but they're an awful lot more expensive. You need to keep them in a separate room, so you can't bring them to the patient, and crucially, they give a lot more dose, which means that they can't be used for routine monitoring and follow-up. Now, what Adaptix are doing with our 3D imaging technology is to create a low-cost intraoral 3D dental imaging system that we can bring directly to the patient, and crucially gives only the same dose as a regular 2D.
You'll have been at the dentist where they point to a slightly darkened patch on a tooth and say, of course, it's obvious you've got a cavity here. And to them it is. It's still quite difficult for them to read. And what we've found is using Adaptix technology, it changed the clinician's perspective in 3 out of 5 cases. Now that's quite important because things like caries are extremely prevalent. And also the nature of therapies are changing.
What I have here is Adaptix's prototype dental system, and what we've got inside is, rather than a high-powered single 2D X-ray source, we actually have one of these flat panel sources, which consists of an array of low-powered X-ray sources that we can turn on and off individually. So if I take the cover off and take a look inside, you can see some control electronics there, and what that does, it allows us digitally to turn each one of those X-ray sources on and off really quickly in turn, and that's what gives us multiple views of the tooth from different angles, which allows then the 3D reconstruction software to make those 3D pictures. It's a really low-powered unit, so rather than a 7 milliamp conventional source, this is only 50 microamps per individual emitter. So because it's low powered, we can still use just a conventional mains electricity, and we also bring it closer to the patient, and that means that we get better depth resolution, so better, clearer 3D slices.
If you take your son or daughter to the dentist and they're able to say, well, look, there's this cavity here, but it's only X cubic millimeters, and possibly it could respond to restorative therapy where they cover it in lacquer and allow it to recalcify. Potentially that's good for the child because they don't have to go through the pain. It means they keep their natural teeth, but you've also given the dentist the courage not to drill. If you've given them that confidence as the status of the tooth, possibly it allows them to use much more conservative treatment, and that's to everyone's benefit.
I'm here with Maury Nashat in his dental practice in Oxford, and we're going to talk a little bit more about our 3D intraoral imaging technology. So Maury, can you show us what you do today for X-ray imaging?
Yes, sure, Conrad. I'll just get my 2D device out. So if we're going to do bite wings or periapicals, we'll take them from the right side like so, and then we'll swing it around and take it from the left side as well.
Right, and the idea would be that we take our 3D X-ray source, but we would mount it on the same type of arm. So just as you can use it right next to the patient as you're treating, same thing with this type of X-ray technology. So Maury, tell me what you see in the images.
Well, with the conventional 2D, it can be very difficult to see early carious lesions, even when we've changed the contrast quite a lot on the 2D. With the 3D image, it's just far superior quality image. You can see so much more detail. You can see how far the caries actually extends.
What do you think the impact of this technology will be?
The impact's going to be huge. It's going to allow the dentist to make better diagnoses, better treatment plans, and therefore the patient can make a better informed decision on the outcome of their dental care. The image detail is so much greater. You can pick up cavities so much quicker. You can then intervene at an earlier stage, preventative measures, and stop the cavity developing.
So this is an antique skull that we image with our technology. Why don't you take a look and tell us what you see?
So this essentially is a 3D bite wing, something which I've never come across before. If I scroll the mouse, what you'll see, which is amazing, is fracture lines will appear on the 2 teeth here. This patient's a bruxist, and they've been grinding their teeth, and you can see vertical fractures through their crowns, which is something you'd never really see on a 2D bite wing.
That's amazing. Right, and you can see root canals more clearly as well?
Yes, so something else which is amazing about the 3D image is the detail that you can see on the root morphology here, the pulp ponds here, as you scroll through from the front to the back of the tooth.
So this is an endodontic example where we've taken a file and a GP stick, and because you can bring this technology to the patient, you can do this during a procedure. So again, Maury, how does the 2D compare with the 3D images?
Well, again, the 3D just shows so much more detail than a conventional 2D. We can scroll through and you'll be able to see this gutter perca point far more clearly than the 2D image. It'll be of great benefit when canals are overlapping, and when files are overlapping, you'll be able to scroll through from one root to the next root and have a better understanding of the position of your file and the direction of the canals.
Great.
We see many good use cases for dental, which will help the dentist deliver a better service, but also help reduce the amount of pain or discomfort that a patient could go through.